Hi, I'm Malika Bilal.
And I'm Omar Badar, and you're in the stream.
Today, HIV and AIDS. What will it take to combat the pandemic by 2030? We'll meet the people trying to do just that. Our digital producer and my co-host Omar Badar is here looking out for your live feedback. And Omar, this isn't always an easy conversation for people online to have.
It's not, and we're hearing a lot from people who are in places where it's particularly difficult. So we have Usman over here who tweeted in saying, one of the reasons why it's difficult to tackle HIV/AIDS in Pakistan is due to socio-political stigma against LGBT community. And we also got a video comment from somebody from Sudan who wants to remain anonymous. Take a listen to what she has to say.
الوصمة يعني ممكن الزول مش الوصمة في المرض ذاته بس انت موصوم عشان عيان والناس تفوت منك، لا عشان انك انت حتتواصل مجتمعيا، يعني حتى يمكن قد تفقدك حقوقك في المجتمع، في السكن، في التعليم، في الصحة، في حاجات كثيرة. عشان كده اي زول خايف انه حاجاته دي ما تضيع منه كمواطن، عشان كده الناس بتحاول بتخاف من الوصمة.
Now we're going to be discussing all of these challenges, but in the meantime, you can join this conversation by tweeting us using the hashtag AJStream.
With all that stigma attached, prevention, diagnoses, and treatment can be hard. So what does combating HIV and AIDS mean to the people living with it and those fighting it? Women and children are the most vulnerable to the disease, which is why singer-songwriter Annie Lennox has made them the focus of her work. She joins us from the Women Deliver Conference in Copenhagen, Denmark. With her in Copenhagen, Dr. Sheila Tanachi-Tulu is the UNAIDS Regional Director for Eastern and Southern Africa. She's also the former Minister of Health of Botswana.
We also have in Johannesburg, South Africa, Lebogang Matsomi is an HIV-positive activist. In Virginia, not too far from here in D.C. actually, we have Gwen Berenger and Sean Decker, who are HIV educators. Sean has been HIV positive since the age of 11. And in Zomba, Malawi, Alice Gadzanja is HIV positive and also a nurse specializing in the care of people living with HIV.
Welcome to the stream, everyone. Now, Annie Lennox, when did you know you wanted to be an HIV/AIDS activist? What was that spark for you?
I was very privileged because I was invited to take part in the launch of Nelson Mandela's 46664 HIV/AIDS Foundation, the concert where all the artists came from around the globe. And the message that Mandela was giving at that time in 2003 was that AIDS was a genocide that was wiping out the people of South Africa at a rate of 1,000 every single day. And because of 46664, I was invited to go into the townships, go into rural communities, clinics and hospitals, and actually witness the HIV/AIDS pandemic as it played out for myself. And as a woman and as a mother, that completely changed my entire paradigm with regard to how women and girls are affected by health crises, health catastrophes at that time, such as HIV and AIDS. And that was 13 years ago, and I have been campaigning ever since.
Yeah, you know, I pulled up a picture here on my laptop, and it is you, a little bit younger, just a little bit. This is in 2003, of that incident that you're mentioning. You're standing next to Nelson Mandela in South Africa. What was it about hearing the word genocide, that made you then want to change what your life's work was?
It was deeply shocking because at that time, internationally, we were thinking that HIV and AIDS was something that had affected the gay community, from the 1980s, or intravenous drug users, sex workers, these kind of things. We had a notion of HIV and AIDS. We weren't thinking that women and children were the face of AIDS. And I myself didn't realize that. I didn't see it that way. And right now, in 2016, HIV is the leading cause of death globally for women of reproductive age. And people still don't know that. It was that fact then, and it is still the same now. We've made tremendous progress, but we're in great danger because the whole thing can be reversed if people do not keep reinvesting in this human crisis.
Sheila, I could see you nod in agreement there when Annie was talking about her reaction, that gut reaction to hearing genocide and hearing that it affected women and children. You've also made this your life's work. What inspired you?
Well, for me, I've always been a gender and health activist. In fact, in the early 80s, my work was on documenting the health of women across all ages. So my motto was always, let's take care of women from the womb to the tomb. But then in that activism, I happened to meet in 1984 Noreen Kaleba, who was coming from Uganda.
Yes.
And she told me about a disease in her country called SLIM that her husband had, and therefore they were being discriminated. So I said, well, we probably will have it in Africa. Now, in 1985, we had the first case of AIDS in Botswana. And that's when I decided that for this particular disease, there will be no discrimination as far as I'm concerned. For that time, I didn't know anybody who was infected. But I knew that if it's going to affect women, then it's mine, and women will not be able to menopause anyway. At that time, my doctoral dissertation was on the experience of menopause among Botswana women. And the way it was coming, I said, well, if it's devastating the way it's doing in Uganda, Botswana women will not be able to menopause. I might as well deal with this thing. And I thought it would take 10 years, by the way. I was younger, and I
Wow.
thought we're going to work this thing. And 10 years
Idealistic
later,
there.
I'll be able to get back. I'll be able to get back to, aging and women's health issues. And I'm still on it. However, I was able to integrate and make sure that we do not, we prevent HIV for older women too. Yes.
So we're actually hearing from a lot of people from around the world, including somebody tweeting in here from the US, from Chicago, talking about something that's a little bit bigger than stigma. We have Hadim saying there's a huge disparity in Chicago in new cases of HIV, which finds its outlet in, you guessed it, poor black communities. If you've never had access to general health facilities, going to a free clinic to take an HIV test is a left field step to take. So even when access is there, it's just not part of the culture. Lebo Khan, I know that you do have some thoughts and a question about how to reach young people to make this part of the culture. Would you like to jump in here?
Oh, so I did have a question for Amy to ask what sort of interventions can we as young advocates and her as a singer, what kind of inventions can we come up with to deal with the spread of HIV, because we know that young people like innovative and fun things. As a singer, is there a way we can come up with nice songs that can relate to young people, that speak to the discrimination and destigmatization of HIV and AIDS?
Okay, I would have to say that the first thing that we need to do is to raise awareness again, that we have become complacent and that we think the whole thing is finished and done away with, when in actual fact it is not. We have still so much further to go. And this messaging really needs to come through in whichever way you can. So education, raising awareness in whichever way you can is so, so significant. And my generation we're still doing what we were doing a decade ago, as Sheila was saying to us. But the thing is that young people now, you have inherited this issue. You are the future generation, and you must be inventive. You must find your own ways to raise awareness within your own generation and bring out the messaging of get treatment, know your HIV status. I mean, first of all, get testing, get tested. That is the first thing, know your HIV status. And of course, it's challenging, but if we have dialogues like this again, we're reviving the interest in HIV and AIDS and not allowing it to go into the shadows again.
Annie, there you were saying, get tested, know your status. Alice, I want to come to you next because your personal story is one that really struck a chord with me. You're a nurse by practitioner, and you contracted the disease, but when you went to the hospital to get tested, what were you told? Can you tell us that story?
Yeah, I'm a nurse. You are right. I'm a nurse by profession. At that time, I was working with the Malawi government. Then that was 1994, because I saw signs of shingles. Then when I went to the hospital, then at that time I had my last born, who was about 5 months old. Then when I went to the hospital, they said these are shingles, that is the sign of HIV/AIDS. Then I get tested. And that was around, I don't know, around December, November 1994. Then they say I was HIV positive. Although at that time, I was worried because at that time we had no drugs here in Malawi, and there were no interventions here in Malawi. And the NGO which I am working now, Dignitas International, was not even appearing here in Malawi. So I was very worried because when they told you that you are HIV, there's nothing, it was just telling you that you have got a cancer, which have got no treatment. So when I went home, I was so disappointed after looking my children, they were very young. And the worst thing, my last born was about 5 months. And when I say, if I die today, who is going to look after these kids?
Yeah.
You know, Malik, we're also hearing from people online who are disappointed with where the burden currently is in terms of dealing with this. People think that there should be more public attention to it. Ibrahim says, I work with HIV patients in Nigeria. Government funding is meager compared to donor funds, not sustainable at all. And we have Muna Claire over here who says there are foundations who take it as a duty to run tests on people and also enlighten them about HIV, even in high school. So you're seeing the burden even in schools basically going to foundations. Gwen, I know that you and Sean have not said much. Would you like to just jump in? I know that you would like to join this conversation as well.
Yeah, Gwen and I'm HIV positive, Gwen's HIV negative. We feel like a big aspect of trying to get people tested is to have people who are living with HIV just talk about the fact that they are deserving of love, and Gwen is with me, and she's not afraid to be with me. And you know, we also think that people need to get tested, and I think if people are afraid of what they think their life is going to be like, that's going to be hopeless, that they're not going to feel like they're worthy of love. Why would they go get tested if they feel like they're just going to be sick and no one's going to want to love them? And so we think that people out there need to understand that people with HIV do have love lives, they have support systems. And I think, as someone wrote in earlier, the stigma is really what keeps people from getting tested. And I can relate to that. When I tested positive 30 years ago as a kid here in the United States, I was kicked out of school. A lot of my friends' parents wouldn't let me come over and hang out anymore. My mom was going around to churches trying to find a church that would let us attend. And one church told her, hold on, I need to educate my congregation. I'll get back to you. And I guess it's been a long education process because I'm not sure if she ever heard back from them. But yeah, there's so many steps. And Gwen, can you speak to somebody if somebody's with somebody?
Yeah, I mean, I think a big part of it is education, as Sean said, getting tested. But I know for myself, getting tested the first time before I even met Sean was really difficult. And then after we were together, my first test was a little bit a difficult experience too, even though I knew we were safe in our relationship. But I think that if I hadn't been educated about HIV, and I was very fortunate to have a good education about it, I would have never been open to a relationship with someone who is HIV positive. And as Sean said, we think that people who are positive need to know that there is love for them and there is a support system available.
Yeah, I could see Annie Lennox nodding to that. Sheila, you were also nodding. So you hear them talk about the importance of education here. Sheila, I know that you are in charge basically of about 21 countries, give or take, and running the programs there and overseeing that. How important is education, and really how far have we come? How educated do you think people are about this disease?
Well, let me say that we've made quite a lot of strides in terms of really bringing down the epidemic. For example, if you look at new infections, we've had a decrease of about 35% globally. Now, in my own region, in these 21 countries, the decrease since 2000 has been like over 45%. So we feel, okay, we've done a little bit. And so far, we've put quite a number of people on treatment. Worldwide, 15 million people are on treatment, meaning that at least we are saving the lives of those 15 million, their lives have been saved. But we are still having people, more than 17 million, who are not on treatment. And also, that same number, who don't know their HIV status. And if we are going to say fast tracking, meaning that we want everybody to know their status and then be treated, it means we have to really start with that very first step of getting people to know their status and working with civil society, people living with HIV, to ensure that they encourage people to go for testing, because that's the first step towards really leading a productive life. Yes.
So we're actually getting a lot of questions from people who would like to, ask Annie lots of questions. One of them is Mumtaz over here, who tweeted in saying, what is the one thing that you want to see happen before you can say Now we will end AIDS in Africa. Annie, can you point to one specific benchmark that you would like to see achieved in the near future?
Well, you know, the UNAIDS has created what they call the fast track strategy, and that is that it's called 90-90-90. Everyone is tested, everyone is treated, and actually that the response of treatment comes in right away. You do not wait until your CD4 count is so low that you're on the verge of death before you receive treatment, right away, and that you adhere to treatment. And this is a stratagem that was looking to actually see the end of AIDS by 2030. Science has proven that we have made vast changes. We have lowered mortality rates. We have access to treatment. So this can be done. What we need is a collective vision, but we need investment in that vision. And what I'm really concerned about is this, that in places where the epidemic was at catastrophic levels, eventually, after millions of people died, there were certain kinds of responses, and they have proved to be effective. But the problem is complacency and stigma. And even in Western countries now, as you say, Chicago, Washington, D.C., certain parts of America, I think they're even more backward than in certain parts of Africa, because Africa had to step up to the plate.
I could see Leyba Khan nodding her head when you were talking about that.
Yes.
I want to, before I get to you, Leyba Khan, I want to share what Annie just mentioned about ending this by 2030. So this is one of the UN Sustainable Development Goals. You can see this here on my website. One of the goals is just that. It's under ensuring healthy lives and promoting well-being for all at all ages. So we tab over here to 3.3. There are a lot of goals here, but one of them is by 2030, ending the epidemic of AIDS, tuberculosis, malaria, neglected tropical diseases. And whether or not that's possible then depends on these smaller communities that are working with communities that are affected. Leyba Khan, I know that that's you. You talk to women all of the time. What do you tell them?
I think I always tell them that testing is important, of course, but then once one is tested, it needs to get on medication and stay on medication. I think another struggle we have is people staying on medication and adhering on medication so that they are able to reduce or rather suppress their virus in the blood. And I just wanted to also comment on the possibility of ending AIDS by 2030. I think another thing that we need to look at is comprehensive sexuality education in schools and adolescents youth-friendly health education, health services, because we need young people to be educated about their sexuality and to be educated about themselves and their bodies. And once we are able to do that, we are able then to bring down the age of when a young person starts engaging in sexual education, in sexual intercourse, and we're also able to give them information around getting infected with HIV, how to protect yourself, how to use condom as a young woman especially, and how to negotiate condom use when you are engaged in a relationship with either someone your age or someone older than you.
And Leyba Khan, I know you're not the only one doing that. Gwen, I see you just trying to jump in there. I'm just going to intro you and give you guys a little bit of props. This is their website. This is Sean and Gwen, a boy, a girl, a virus. So you do this. You have a YouTube channel. This is exactly what you do. What do you tell people?
Yes, I couldn't agree more with what Leyba Khan said. Talking to young people is what we do, and talking to them at early ages is very important. I think that comprehensive sex education is really one of the main keys for young people to be educated about this. They just released some data saying that abstinence-only education, as a lot of us know, doesn't really work, and comprehensive sex education is what really works, and that's what both Sean and I believe.
Yeah, and to speak to the notion that education is lacking in the United States. Gwen and I, we speak at colleges and universities, and we found that it was really hard for us to get into high schools, and that's one of the reasons why we started a YouTube channel, because we're like, teenagers are turning to the internet to get information about sexual health, and so we just thought, well, why don't we just put everything we do for college students online for younger high school students to check out. And so, yeah, we really have a lot of hard work to do in the United States about getting people open to the idea of having educators come in and speak to young people about sex, because God knows they're talking about it amongst themselves.
And they're learning about it on the internet, but not always through the best sources.
Yep. So we mentioned a little bit earlier the 2030 goal to try to end the epidemic. We have some people who think that's too ambitious, but we also have some people who think that it's not dealing with the urgency in a proper way. Ben tweets in saying, the World Health Organization recommends universal HIV treatment. How long will it take to deliver treatment to millions? Goes on to say, with 4,000 deaths a day, that statistic might be off, but the point is still the same. How many will be lost until we implement testing, care, and treatment? Alice, I want to throw this to you. What do you think of the 2030 goal? Is it too ambitious, or is it not urgent, not dealing with it urgently enough?
With the 2030, the HIV infection will be reduced. What I mean, because like here in Malawi, we are doing PMTCT, which is the option B+. So, which means all antenatal mothers, the whole Malawi, when they go to antenatal, they are tested HIV. And the ones who are found positive, they start ARVs immediately, so that they shouldn't give it to their newborn babies. And we are also checking the viral load, because if the viral load is very low, it is very difficult to give HIV to one another. We are also doing the TB HIV integration, because at first, when somebody was having a TB, we were just looking on that TB, that's all. And as a result, so many people maybe we are dying. So with this TB integration, it means since TB is our third stage, so we test everybody with TB.
Right.
And those who have been found with HIV positive, they start ART immediately.
Right. Annie, I want you to use the story that we just heard Alice talk about, testing people, and of course testing young is important, to give us a little bit of a hopeful story. I pulled up on my screen here a picture of a young girl at the time who you met. This is Avalele. Tell us about her.
Yes. Well, Avalele was a little girl that I met in a hospital in the Transkei in the Eastern Cape. She was 7 years old at the time, and really her life was in the balance. She had full-blown AIDS and pneumonia and was absolutely skeletal, weighing less than a 1-year-old child. And when we left Avalele at the hospital that day, we didn't know if she was going to survive. 5 months later, after treatment and good nutrition, Avalele turned around and became, really, for me, the poster child of health success. What we want to see. It is absolutely the most awful thing to see a little girl of 7 years old being infected, being born with HIV, and just being one of the statistics of millions of children that have not survived. And to see this actual real success story with treatment is proof. And we could take it. I could take this story as an advocate. I could take it to people and say, look, this is Avalele with AIDS. This is Avalele after treatment. It works. And you need this kind of proof. So this was the story of this little girl.
And this last picture I'm showing is you with Avalele. She looks happy. She's wearing pink. You look happy. So that is a happy story.
Yes, we're very, very happy. But this thing is, that photograph was taken 7 years ago. And so Avalele is now a young teenager, and she's doing very, very well. And this is the sort of thing we want to see. We want to see, when you know that the highest cause of mortality for adolescent girls in sub-Saharan Africa is HIV and AIDS. So we want to really tackle this. This is a global concern.
Sheila, it's a global concern. We have just under a minute. Do you think it's achievable, 2030?
2030 is achievable. And we can actually even concentrate on women and girls, because that's exactly where the epidemic is rising. But I'll tell you, if we had to do only one thing, to me, it would be, in the absence of a cure, the only vaccine we have against HIV is to keep girls in school, to end child marriages, to eliminate gender-based violence.
Three points
and to
there that I'm going
really-
to leave us with, Sheila.
That's
Thank you
right.
so much. Annie Lennox,
Yes.
Sheila Tlu, Lebokhan Matsumi, Alice Kazanja, and Gwen Berenger. Sean Decker, thanks for joining us. We're out of time. We'll see you online.